Hello. This video is going to instruct you how to release rib tightness, middle back, and upper back tightness and do a self-mobilization. All you need is a washcloth and a rug or mat to lie upon. So go ahead and pause the video and grab those things. Once you have the washcloth, you could fold it in half and then roll it up so it's about the length of a rib. Okay, and if your rib's in a lot of pain, you don't need to roll it all the way. You could roll it partial of the way, or you could roll it all the way up. And then go ahead and lie on your back.
Now take the washcloth and you want to put it under the very rib that is in the most pain. And so I'm going to pretend like my rib pain is right here. And I'm going to go ahead and place it underneath there. And then have your knees bent a comfortable distance apart. So your knees are about hips width apart. And your arms are relaxed on the ground. And just pay attention to how your shoulder blades are making contact with the ground. Now, if this is too much pressure on your back, you could either take the washcloth away or unfold it a little bit. So we're going to focus on the right side, pretending that my right rib has pain. And what I want you to do is first imagine your shoulder blade on your right side. And push the top of the shoulder blade ever so slightly into the ground. And then release it. Do this again, the top of your shoulder blade, pushing it down into the ground ever so slightly. And then release it. But do this in a way that you're not holding your breath. Okay, and then pause. And now think about where the middle of your shoulder blade might be. And see if you could just imagine pushing the middle of your shoulder blade a little bit heavier into the ground. You don't have to actually do a big push. Like you may not even see anything moving in my body. You're just thinking about pushing the middle of the shoulder blade into the ground. Great, and pause. And then think about where the lower part of your right shoulder blade is. And then just imagine that you're pushing the lower part of your shoulder blade into the ground. If you're unable to do it, just think that you're doing it. Just imagine. And now pause. We're going to go upper, middle, lower. So follow my lead. Push your upper shoulder blade, your middle, and your lower. It's hard to push the lower. Upper, so you might want to just think about it rather than actually doing it. Middle and lower. Wonderful. Okay, pause from that. Now take your right hand, palm is down towards the ground, and think about where your thumb is, and very gently push your thumb ever so slightly into the ground. Exhale, release. Index finger, push your tip of your index finger ever so slightly into the ground and release. Middle finger, push the middle fingertip into the ground. Exhale, release. Ring finger, push the tip of the ring finger ever so slightly down into the ground. Exhale, release. Pinky finger, very gently push it down into the ground. Exhale, release. Let's do that one more time. Thumb, and make it really gentle so you're not doing any excess muscle contraction. Index, push it about 2 times into the ground, really slow and gentle. Make sure there's no excess contraction happening in your hand, happening in your arm, happening in your jaw. Everything in Feldenkrais, we want to do it super gentle. Okay, I'm on my middle finger now. Super gentle. One of the intentions with Feldenkrais is to use the least amount of force or the least amount of muscle effort possible. Ring finger, think about your ring finger, and ever so subtly just push into the ground, but it's almost so subtle of a push. Okay, and then the pinky. Great. And imagine all 5 fingertips on the right side and ever so slightly push the 5 fingertips down into the earth. Exhale, release. And do it one more time. Pushing all 5 fingers tips ever so slightly into the earth. One more time, push the 5 fingertips ever so slightly into the ground. Exhale, release. Okay, just roll a little bit to the left, just enough to take the washcloth away and lie on your back and breathe. And imagine that there was a line going down the middle of your spine, dissecting your body into the right and left halves. And ask yourself, what's the difference in how your body is lying? How is the shoulder blade on the right side making contact with the ground versus the left? What's the length of the right arm versus the left? How much of your lower ribs are in contact on the right side versus the left? Just keep noticing all of the differences that you feel on one side versus the other. Everything in Feldenkrais is super subtle, yet it makes a huge change in the body and in the nervous system. Okay, so take this washcloth once again, make sure it's rolled up, and put it back in that same spot unless it's too painful. If it's too painful, you can move it to one rib higher or one rib lower. And now what I'd like you to do is tilt your knees to the left and then bring your knees back to the center. And by the way, if your pain is on the left side and you're performing this exercise on the left side, just reverse all my rights and lefts. So right now we're tilting our knees to the left and going nice and easy, staying in the range of ease and comfort, and then coming back. And as you tilt your knees to the left, feel the pull in your back, pulling your back and spine down towards your pelvis. And also feel how your lower ribs on your right side come gently off the ground and they rotate to the left. Feel the line of pressure as it lifts off the ground on the right side and then it comes back down onto the ground. Do this one more time. And then come back to the middle and just take a pause and breathe. Put your hands on your middle section or wherever you're having the pain. And just breathe. Expand your breath into your hands. But do it with a nice, relaxing, rhythmic breath, not a forced breath. Make it feel good. Make it feel easy. Everything in this lesson, make it super easy. Great. Now walk that right knee just a little bit more to the left, so it's kind of at your midline, center point, and cross the left knee over the right. And then what I'd like you to do is very gently tilt your knees to the left. And then come back to the center. Keep tilting your knees to the left, keeping your nose more or less facing up towards the ceiling. And then back to the center. So in Feldenkrais, we're exploring the connections between all of the movements in our body. So as you tilt your knees to the left, you can feel the line of pull, pulling your right shoulder downward and your head downwards. Tilt it to the left. Feel all of your body getting super lazy, allowing all your muscles to just give into the floor, give into the movement. You might notice a slight tilting of your chin downward as your knees tilt to the left. And you can do it one more time, and then nice and lazily uncross your legs, slide your legs long, take the washcloth away, and take a full and complete rest. And if you're having low back or rib pain, it might be easier to bend your knees. It might be more comfortable. And as you bend your knees, your back flattens on the floor. And from this position, just feel what's different. Feel if the right side of your face feels more open and soft. Feel if it's maybe a little easier to roll your head to the right or whatever side you just did. And for the last thing, take your knees to the left and then back to the center. And as you take them to the left and back to the center, you might feel the part where your washcloth just was relax even more towards the ground. And you might feel a slight softening of that area where you had pain before. And usually if you have pain, you have a little bit of muscle contraction as well. So our goal is to soften that area and to help you to let go of the holding around that area. Come back to the center and just stay completely still, checking inward once again. You could stay here as long as you want. Feel the differences, explore the changes that have happened inside of you. And when you feel complete, you're going to come up and go for a walk around the room. The way you want to come up is you're going to roll to the side. If it's painful to roll into your right side, roll into the other side and use lower arm, upper hand, and your head comes up last. You push yourself up to sitting and then take yourself up to standing. Go for a little walk around the room to explore the differences. And then you could go ahead and lie back down and do this video again on the other side. I welcome your comments and your questions below. And if you have any requests on a different video you'd like me to make, feel free to leave that suggestion below. Thank you and have a great rest of your day.